Last week I talked about how Doug Ford and the Conservatives were fighting in the courts to keep secret how bad the nursing situation was in Ontario. And apparently it was so bad that the courts ruled that it needed to stay secret so that things didn't get worse in Ontario. But now we know how bad it is, and it is bad. Because it is expected that by 2032 we will be short 33,000 nurses in Ontario and 50,000 personal support workers. For reference, we only have 100,000 nurses in Ontario, meaning that we will be short 33% of what we have now. The systemic harm that Doug Ford is doing to the healthcare system in Ontario is one that will not be overcome for literal decades. This is a complete dismantling of our healthcare system. And I now understand why the court said that this was so bad that it needed to stay a secret so that things don't get worse. Because who in their right mind would become a nurse knowing that we are going to be understaffed by 33,000 nurses across the province in less than 10 years. Nurses have always been underpaid and overworked. That has gotten significantly worse under Doug Ford, and it is only going to get worse as he continues to be our premier. This is how we get privatized healthcare. Doug Ford starves the system, he strangles it, and then he says, well, the public system's not working. We need to bring in private care. And don't forget that the former Conservative Premier of Ontario, Mike Harris's wife, owns one of the largest private nursing agencies in Ontario. Like, it's actually so bad.